Hello everybody, in this video we will speak about the principles of petrol therapy, about the laws or rules that lie behind every treatment, but we aren't often aware of them, but they can significantly influence the result. Let's start with a Chinese proverb: give a man a fish and you feed him for a day, teach a man to fish and you feed him for a lifetime. This proverb demonstrates the difference between classical medicine and Bach flower therapy. And it is very important to differentiate these two kinds of treatment, because if you use the classical thinking about the therapy and use it to Bach flower therapy, you will probably fail. Where is the difference? So first of all, there is a difference in the premise. In classical medicine, the patient is weak and he needs some help from the outside. And the therapist is the person who has all the knowledge and who makes the qualified decisions. In Bach flower therapy, the patient has resources of his own, and these resources are sufficient for dealing successfully with the problem. And he is also able to make the right decisions. And he maybe only needs information to decide better. And there is also a difference in the diagnosis. In classical medicine, it is usually some deficiency or excess. There may be a lack of some hormone, for example, of some nutrient, or there may be an excess of some reaction like high blood pressure or excessive allergic or immune reaction in allergy. In Bach flower therapy, the problem is some block that hinders us full usage of our resources. And that is why the therapy is also very different. In classical medicine, it is either replacement, removal, or suppression of some excessive reaction. In Bach flower therapy, it is just offering information for the correct readjustment of the system, either in the form of the essences or words. And there is also a difference in prognosis. In classical medicine, the problem is chronic and the patient will constantly need some help. While in Bach flower therapy, the problem is only temporary, and the therapy will be stopped in the future, and then it might be restarted if necessary. And there is also a difference in the relationship between the patient and the therapist. In classical medicine is necessarily unequal because the therapist has all the knowledge and all the resources. On the other hand, in Bach flower therapy, it's more equal because the therapist has some knowledge about the essences, while the patient knows himself and has the resources for the treatment. And there is also a different condition of success. While in classical medicine, the condition is obedience, or in better words, compliance of the patients. In the Bach flower therapy, a cooperation is necessary. We can imagine our patient in Bach flower therapy like a rich man who wants to invest his money and asks you for help in this investment. And maybe he has already invested some money and he suffered a loss, and that is why he hopes that you will help him to invest the money better. But this money will be always his. And there are 5 principles that stem from the difference between classical and medicine and Bach flower therapy. The first says that it is possible to treat somebody who has some resources only. The patient has his will and is able to make decisions. The cure is never free of charge, and the patient must pay something for the treatment, for the result. The remedy is effective only when its action is in accord with the goal and effort of the patient, and the remedy always acts in the best interest of the patient. Let's speak about these principles in detail now. It is possible to treat somebody who has some resources only. Uh, of course, it's impossible to treat somebody who is, for example, terminally ill, um, a very old person who has no strength anymore, or who is on artificial ventilation. The problem is that the patient often isn't aware that he has some resources. He considers himself as weak and as powerless and incapable. And the task of the therapist is to help him to find the resources and to develop them. It's surprising that, for example, what the patient sees as most weak in him may become his biggest strength. For example, mimulus persons can develop their courage and they may even become more courageous than the other persons. The second principle is that the patient has his will and is able to make decisions. And during the therapy, it is really the patient who decides, and we only can offer information. He is the investor who has the money, so we can tell him, you must give the money here. He won't listen to you, he won't obey. It must be some agreement. And the therapist should always respect the patient's free will. And sometimes some therapists are agree with giving remedy to somebody without his permission. For example, a wife gives the essences into the drink of her husband without knowing it. And it is definitely a violation of this principle. The cure is never free of charge, and it doesn't mean that the patient should necessarily pay for the treatment. Of course, it depends on you, but he will certainly have to pay in the form of some effort, of some overcoming some obstacles, of dealing with painful emotions, for example, revealing some secrets to you. Otherwise, you cannot do a correct prescription. He should also be ready to take some risk, because every change carries some risk. Or he may need to learn some new skills. The problem is that some people think that the Bach flower therapy is similar to classical medicine, where it's like in a repair shop, where you take your car, bring it there, and say, okay, I have some problem with brakes, please repair it. The next day you come and your car is repaired. This way, Bach flower therapy doesn't work. A cooperation and effort of the patient is necessary. The remedy is effective only when its action is in accord with the goal and effort of the patient. And it's, for example, Mimulus boosts courage. Centauri helps to tell no. Pine relieves reproaches of conscience. And impatience helps to be patient. Of course, if the patient doesn't want to be patient, he thinks that the problem is on the side of the other people, so the impatience probably won't work. And you cannot change the patient according to your expectation, according to your wish. You cannot make him more tolerant, patient, less manipulative, or less domineering if he doesn't wish it. And the remedy always acts in the best interest of the patient. So the remedy never will support the patient in a self-destructive or destructive behavior. Okay, and let's demonstrate these principles on a practical example. An overworked middle-aged woman. Her main complaint is that she feels very tired and she takes care of the whole family. She has no time for herself. And family members even do not appreciate her effort. So, of course, your idea probably will be to give her Centauri. However, let's go through the principles. It is possible to treat somebody who has some resources only. So the question is whether she really has any resources to how to deal with the problem. It's possible that she has come to you in a state of a complete exhaustion and she wants only to sleep, and she hopes that your drops will help her to boost her energy. But in this situation, probably the essences won't work. So it's better to recommend her to take sick note, for example, to take some holiday, to leave for a while, and maybe it's even possible that she will need a low dose of antidepressants for some time to be able to get from the deepest uh, exhaustion. The patient has his will and is able to make his decisions. Although you may have some idea what the problem is, it is important what the patient thinks about the problem and how she wants to change it. If she is not ready yet to make some radical change that Centauri probably could provoke, she may need some preparatory essences, like she would feel guilty if she wouldn't fulfill all her duties, or she feels it's her obligation to fulfill all her duties, or even she put herself into a victim position and she complains and complains, but she doesn't make any change. So she may need pine, oak, or for example willow for starting of the therapy. And it's of course possible that next time she comes and she agrees with making some change in the dynamics in the form, for example, of Centauri. The cure is never free of charge, so she must be ready to invest something into the therapy, like speaking about painful themes, about her family problems, and also to take the risk and to tell no, because when she decides to tell no, it really causes some chaos, some change of the dynamics of the family. Maybe the husband will be angry at her, will be disagreeable, irritable, and will try to push her into her previous position. So she must have some strength, some courage to deal with it. And maybe she will need to learn some new skills like driving a car. And the remedy is effective only when its action is in accord with the goal and effort of the patient. For example, Centauri will be effective only when the patient feels that she invests a lot of energy and she has no time for herself. And she wants to shift some part of her home duties to other family members to tell no. Otherwise, Centauri won't work. And finally, the remedy always acts in the best interest of the patient. So it is possible that the patient's requirement will be to recharge the energy only, no change, no other change. So the essences cannot supply energy from the outside. They help only to use better one's resources. And if you, in this condition, you decide to give her olive only without helping her to deal with the principal problem, the therapy will fail, and it is good because otherwise it could harm her. So the essences either would do nothing, or maybe she will be more sleepy. So she will terminate the therapy by herself. So thank you very much for watching this video. I hope you have enjoyed it. And in the next video, we will start to speak about communication techniques.